I don't know why I haven't brought it in. I actually have like a
clapper?
clapboard. Yeah.
Nice.
I don't. Okay, you ready?
Sure.
Okay, I know you've been thinking about this for a while.
Uh-huh.
When you think about your dental office, where's like the origin of all of this? Don't think too hard about it. Like, just what is like your why? The main thing that got you to do everything at Inspire?
I was trying to fix myself. I had a lot of issues that I didn't realize were all dental related. And so in my journey to fix myself, I ended up here. So I finally realized that I had a bunch of dental related issues. Probably, I was an associate and I was actually working for who I would consider my mentor now. He's like my favorite dentist. And he encouraged me to go and take some orthodontic courses. And so he told me, like, here's this one that I did. You should go take these and start to treat some people for orthodontics. I was like, okay, cool. So I went to this course, and as I'm sitting there, they're talking about people that have had headgear, that have headaches daily, that have neck pain and shoulder pain and all of these things. And I just sat there and checkbox every single thing. And I was like, okay, that's me. Why do I have all these problems? And then they went to explain like all the issues that can stem from just your mouth not being in order. And so a lot of times, so I was like, okay, I need to fix this. So I need to figure out what's going on. So I was sitting there through that course. I actually met one of the people that we work really closely with. So you hear me talk about my cold laser all the time. My cold laser is from BioResearch, and the rep that was there, Nate, he was there and he saw me in the back, like, stretching my neck out, like trying to like get comfortable the whole entire time. So he's like, let me laser your neck for you and I'll show you what the laser could do. I was amazed. I was sold like after 10 seconds. I was like, give me the laser. And it gets rid of so much inflammation. I felt great after that. Like my neck didn't hurt anymore. Obviously it came back after a while because I had underlying conditions, but the laser was like amazing. So I was like, okay, I know I need to use this in my practice at some point and help people with that. But so I went home and found more courses to take to try and figure out what else was going on with me. And it just kept going from there. So I figured out I had TMJ issues. And that was underlying probably for most of my life, but I didn't realize it. I had a really gummy smile, which I didn't realize was an issue. And that actually was a breathing issue that was probably going on my whole entire life. So I just figured out all these things stemmed from something that I could help people with at a really young age and even as adults. So if I'm having this problem, other people probably are too. And I know I needed help, so I want to help other people fix this. So it just kept snowballing.
It's amazing that you wanted to actually look into it, because a lot of times I feel like, so I've had TMD for a long time. Like my jaw clicks, I can't open it wide enough to bite an apple. Mm-hmm. I've just learned to live with it.
Yeah.
And I feel like that's what a lot of people do, but you're like, okay, I gotta do something about this. And then it kind of led into your practice, and now you're helping other people.
Yeah. Well, when you live with pain, you don't really realize that it could be so much better. So at that point in my life, I had Advil and Aleve in my purse when I was in college and dental school, my backpack, in my car. It was everywhere, and just because I didn't know when I was going to need it. And I didn't realize that was probably not normal. Daily headaches aren't normal. You shouldn't be living with that. And that was my normal, so it was fine. But once I got out of pain, so after I was treated with an orthotic, I had an orthotic, I started seeing a chiropractor, I completely overhauled my diet. So I did a lot of things in a span of time, so it wasn't all instant. I didn't do everything at once, but it was a little bit at a time. And once I started to do that, I was like, oh, I don't have the headaches. I don't have, all the pain or anything like that. So now if I do get a headache, it's way worse because I know what no pain feels like.
Right.
So it's like, oh, this is what normal life is supposed to be like. And you just don't realize your life could be so much better. Like when you're in the middle of all the thick of the pain, it's your normal and you don't realize that you're actually suffering. So then I don't want people to have to live with that if they don't have to. We're here to help and get you out of that, because I know now looking back, It wasn't fun. You know, you weren't living your best life, and we don't want that. And it could be easily preventable. And kids, we could fix all of that so we don't get to that point as a teenager or, 20-year-old.
It's so funny as like a dentist that you got to this point where you're looking at overall health. I mean, we always say, like, now in the dental field, a lot of things are preventative, especially with hygiene, 6-month recalls, fluoride, but now you're really looking at the whole body. Yeah. And you're diving so deep into one subject like TMJ and helping people realize, okay, there's a bigger issue here. You could be in less pain. So when you first started like Inspire Dental Wellness, why did you pick Inspire? What was that?
So I always say it kind of has a double meaning. So my whole focus in dentistry is breathing. So being able to breathe properly, being able to breathe well. So we do that in a lot of different ways. We try to expand people's jaws so that you do have enough space in your mouth for your tongue so that you can then breathe well through your nose. When we expand that top jaw, every little millimeter that we get in the top jaw is exponentially, bigger in your nose. Even though you don't physically see it, on the outside, we are increasing your nose width so that you can breathe easier. So Inspire is, to breathe. So that's the one part of it. I want people to breathe well. And even though, dentistry, people usually think of teeth. I'm kind of on the outskirts of that. Yes, I treat teeth all day long, but I also look at the whole body and being able to breathe well. And then inspiring, I just want to inspire people. So, inspiring better dental health, better overall health, and that's really my main goal is better overall health. Like you said, we're not just looking at teeth or, making sure we don't get cavities or anything like that. Yes, that is a big part of it, but we want you to be able to live a happy, healthy life and not be in pain and basically live the most optimally.
Yeah. Yeah. And your nasal cavity's right there.
Yep.
I mean, like everything that goes into your mouth also affects your heart. And we know that because periodontal disease, any medications that you're taking, any diseases that you have in your body will manifest itself in the oral cavity. So have you seen a patient yet, like from the beginning until the end of their treatment where they're just like completely, like there's an overhaul in their life? Have you seen that yet?
Yeah. So we've had, and it all depends on what treatment we're doing. We've had a few people who we've treated for TMJ, and they came in and they were in chronic pain, and you just kind of shut down a little bit. Like you don't have that liveliness in your eyes. You probably don't notice it because you've been living like that your whole life. But when we see you frequently, and then all of a sudden, like you come in looking like a different person, there's a change. And after you live like that for a little while, you do realize, okay, something has happened. And so we've seen that with a few TMJ people. We've had a few children who we've done a couple different things. We've expanded, we've done myofunctional therapy, we've done functional frenuloplasty. And they've seen a huge difference in their sleep, which is what we're really trying to treat. Like, people don't realize how important your sleep is. So being able to breathe in your sleep is a big part of your life. You're spending a lot of your life sleeping and healing. And if you can't do that well, then when you're awake, you're not going to be functioning well. So we've had a couple kids who have come in and been like, I sleep so much better now. And they just look awake. I had one kid who was literally, the first time I saw him, falling asleep in my chair, like trying to ask him questions. He could not pay attention, couldn't he was trying to look at me and like say things, but mom had to answer all the questions because he was literally like 2 seconds later be snoozing. Now he comes in talking all the time. So like we can't stop him. We're like, okay, you need to take a break so I can get in there.
That's amazing.
Yeah. So completely different kid, 100% different.
This might be a little off topic, but I just thought about this. So you started off as a dentist, and then you were taking orthodontic courses, and then that led you to this whole like slew of everything with like breathing. You went to the Breathe Institute. You added on myofunctional therapy. Do you see yourself expanding the practice even more, like to add in kind of like an overall health type of thing? So like you're packaging things now, like mini sprouts just started. So do you have like a vision for that? I
think the overall goal would be to get other practitioners to be either our referral sources that we have a really close relationship with, or have them all in one space, which would be the best, because having everybody in one space makes it so much easier. We see that all day long. When I have someone that I'm talking to in hygiene, when they're getting their teeth cleaned, I'm like, okay, so you have this jaw problem, and you have, your tongue is sitting really low. You should see our myofunctional therapist. It just makes it so much easier when it's all in one spot, instead of saying, okay, here's this card, call this person, and then you have to count on the patient, really wanting to do that and understanding everything that you just threw at them right now. So
they walk out,
exactly.
And they get busy, and
exactly, life happens, and we just can't expect everybody to follow through 100%. Whereas if we have an inner office and you can make that appointment right as you're leaving, it's so much easier. And then you get the benefit out of it too, because you don't realize, how much this stuff actually helps. It sounds a little crazy, like, what is this, tongue exercise going to do for me? But it actually does help. And once people are in the thick of it and seeing that it does help, it makes more sense. But when you're just telling this person, oh, this is what you should be doing, sometimes you're like, I don't know, we'll see. I have, something better to do. Let me go do something else. But yeah, no, overall, it would be great to have everything under one roof. So we just need more like-minded people. We need to find those people. Like, we would love, well, we were just talking, we would love to have like an ENT that we work with all the time. Yes. So because that is a major, driving force. Like, we have people that have tonsils and adenoids that are really large, or a deviated septum, and we need someone that is very knowledgeable and willing to see these people. And so that's one thing that we're like, ooh, that'd be great to have.
A chiropractor would be cool too.
That would be amazing.
Yeah.
Chiropractor, and then also someone for nutrition. That would be my other goal.
Oh my gosh,
yeah.
That would be like a full thing.
Yeah.
Yeah.
I mean, I go over nutrition, but it's very face value. So obviously, I am not a nutritionist. I have no clue. I just give everybody, like, these are the foods that are most likely inflaming you that we need to try and get rid of the best we can. And, and diet is the huge, it's hard for people, if you're not used to cooking and you're on the fly all the time, got to go pick up some fast food so that you're not starving. So it is difficult, but it's one of those things that I know the value of it because I experienced it myself, but I need to find someone to sit there with patients and do all of that with them.
Coach them. Mm-hmm. Yeah. Is there anything that you wanted to touch on with the whole, because we kind of like, we went a little off track there. I was just asking questions. But let's bring it back to, like, okay, the history. So we talked about you taking the classes, and then you're like, oh, let me take more, and let me see what's going on here, because it started with the cold laser. Mm-hmm. And now you've got this cool machine that, like, looks at your airway and your sinuses. Is that part of, like, the whole history of it? Did you want to talk about that?
I mean, that's just a tool that I really, like, history-wise, I could really go back, like, now knowing what I know and just having learned so much, like, I could go look back at my whole history, as even up to being a toddler, and I know, like, okay, these were all warning signs, like, that if, we would have known at that point in our lives, it would have been like, oh, this should probably not be happening. So one of the really funny things, which just showed up on my social media when we did the little mini sprouts. So one of my cousins commented what my nickname was as a toddler, and it was Dribbles, which is really cute. You're a little toddler drilling all over the place. Like, everybody thinks it's normal. Well, my uncle had, named me Dribbles, and so that was my nickname, which, it's fine, and it's cute at that age, but drooling is not normal. Like, excessive drooling is not normal. You're always going to have some drooling at different, different timeline, but drooling all the time is a sign of not being able to swallow properly. You're not able to handle all the saliva that your body's creating, and it's not that it's too much, it's just that you're not swallowing well. So that probably would have been a really good sign that I had a tongue tie at that age. It just went undiagnosed because it wasn't all the way to the tip of the tongue. We did not know what we know now about that, but that is one of the things that I was like, oh, okay, that should have been a, like, light bulb. And now knowing what I know again, you can't go back and change things, but that should have been a red flag. And then as I got older, I had a really gummy smile. So that, I was like, why do I have a gummy smile? Nobody else in my family really had a gummy smile. Probably goes back to the tongue tie thing. So I was drooling all the time as an infant. My mouth was open, so I wasn't breathing through my nose like I should have been. I also had really bad allergies. So I was allergic to the world. The outside world, everything in foods. So I had a lot of allergies as a kid. So that then also probably made me mouth breathe. So then my top jaw grew down, so I had a gummy smile. So that, was a red flag at that point too. So I probably had a whole bunch of myofunctional problems that we just didn't know about. So all of that stemming from like when I was really little, just kind of propagated. It kept getting worse and worse and worse. And then into my high school years, I had a really bad concussion. Sports, good old sports. Yeah, and that's, a lot of people, sports or, I was tackled, so I like hit the back of my head, really bad concussion. And we don't realize what all of that does to us. Like I probably had whiplash at that point too and had jaw issues, just didn't know it. I had retractive headgear when I had braces to kind of make my bite better because I had that gummy smile. So all these things that we did to look better, and it was actually probably making me function worse and making my airway worse. And then I had the headaches. And then, so I just went on with chronic pain for a lot of years. And then we finally got to the point where I was like, okay, I'm a dentist. Let me try and figure this out. And then I started to put all the pieces together. And it took years. Like it wasn't something where I was like, took one class and like, oh, I know what all my issues are. It took a long time. And every single course I took, there was a new layer and something else that I looked into. And that got me, I took all these orthodontic courses and then that got me to looking into tongue ties. And then I ended up going and learning from Dr. Zagi. And then we even just went and did a cranial fascial release course. So there's always something else that we're learning and trying to figure out what's going on and how to better help people, because I experienced all of that too. And just because I had all X, Y, and Z doesn't mean everybody else is going to either, but everything presents differently for different people. So we try and figure out all those different ways that it just comes back to...
It's almost like you had all of it.
I know, right?
You had all of it so that you could go through the pain and then go through like the recovery process and learn how to fix it.
I feel like I was like my biggest guinea pig was me.
Right.
And then, so I'm able to tell everybody about all the things that could possibly happen if you come to my office. We have all these treatments and I went through them.
Right. So I know they work.
Exactly. Well, you want to fix that gummy smile? I did it. You want the functional frenuloplasty? Did that too. So yeah, I've done every single thing that I recommend, and there are things that I did that I don't recommend. So I definitely was the guinea pig in order to figure out what's the best.
It's different when you learn these things as case studies, and then when you're the actual study, and you know what it's like to go through all that, so you can recommend certain things to patients and be like, okay, I believe this is going to be what's best for you.
Right.
And I've tried that and I don't recommend that at all. Instead of, this is what I learned in school, this is what we're going to do.
Right.
Because you went through that too. You had the headgear. You had didn't you go through braces twice?
I did. So I did braces when I was in high school, and that was when I had the headgear. I then had relapse. So I did relapse, and I did clear aligners at that point, and that was probably maybe 2 or 3 years after the first round of braces were off. Then I became a dentist myself, so then I still had relapse, so my front teeth always wanted to go back to where they were. And now knowing what I know, that was actually my frenums pulling all the time, and my lips also putting extra force on my teeth. So I just didn't know that. So I just keep thinking, okay, my teeth keep turning. Like, let me fix this. So I did a round of Invisalign on myself. So we did that. And then I finally did the last round of orthodontics, which was with the person that I learned from, Dr. Ed, and that's where I had the expansion and I had the intrusion. So we got rid of my gummy smile. We pulled everything up with TADs, which are just mini implants, and put my jaw in the right spot. So we did all of that, and that finally fixed everything. So my last round of braces, 4 rounds.
Wow.
Mm-hmm.
Joy told me 2.
No.
4. 4. Oh my gosh. I had a question. I don't know. I kind of got lost in like, hold on. How many ortho treatments has she had? So
Too many.
Braces, and then a couple of years later, you did it clear liners. Was it Invisalign?
Yeah.
I'm guessing. Yeah, Invisalign, and then 3 times. Crap, I can't remember my question. It was so good too. Okay. Was there anything else that you want to talk about with the history?
I don't think so. I think that was...
You did write a lot of notes, so if you want to go through that.
Yeah, let's see.
How do you think she's doing, Paul?
You want to show him the Dribbles Cup?
Dribbles Cup?
Yeah. So this is how... I didn't really remember that I had this nickname. So the uncle that coined this nickname, he passed away, and my aunt gave my mom the cup back. So my mom used to paint ceramics all the time.
Okay.
And so she painted this ceramic cup that has dribbles all over it. And I was like, what is this? And I'm like, oh, that's right. My nickname was Dribbles.
Wow.
So yeah, she gave me, that was my present to my uncle, like when I was 1 year old or something.
Oh my gosh.
So yeah, so now it's downstairs on my desk as a reminder of this is what I'm trying to fix.
You have to go through all this paint just so that you can get to this point.
No dribbles for kids.
Do you tell your patients that story? Or like tell the
I
kids'
must
parents?
have put it somewhere because someone knew that my nickname was Dribbles.
Instagram story, I think.
Was it? I don't remember.
Hold this up for the camera. Here. Show it. Yeah. Oh, stop it. Your mom made this, you said?
Yeah.
Here, show it.
Gives authenticity to an actual story. Right?
Oh, wait. Yeah, I'm putting that picture that you put up on Instagram. Okay, hold it up. Can you see the thing?
Yeah.
The Dribbles Cup. That's awesome. Do you still drink out of that?
No, it's my pen
just-
holder now.
That's adorable.
Yeah. Let's see, 85, yeah, so I was 1 year old. Yeah, love dribbles. So yeah.
I saw someone comment that. So that was your cousin?
So that was my cousin. That's on my father's side, and that was the son of the uncle that he.
Okay.
So he commented.
That's awesome.
So one of the things. So in dental school, I was still having a ton of headaches and migraines, and it got worse while I was studying for boards. So to get my license, because obviously that's a little stressful. And it got really bad to the point where I thought I needed a root canal on my tooth. And luckily, my school had just gotten a cone beam. So that's the 3D x-ray that I also have in the office. So we took a cone beam of the tooth that I kept pointing to as being the source of all my pain. And they're like, there's nothing wrong with the tooth. Like, you don't need anything. It's something else. And I was like, it is this tooth. I need a root canal. It is killing me. And it wasn't. So it was most likely my TMJ problems that were, causing my headaches and everything else. But I was pointing to that one specific tooth as being the issue. So at that point, I didn't know what I know now, of course. And, I just thought I cracked the tooth. I was going to lose the tooth because, going catastrophizing. Everything is horrible. It's all going to come down to losing that tooth. But yeah, so that was one of the major things that happened. And I also had a ton of earaches. So earaches all the time. I went to so in dental school, I had to go to the college that we were associated with. I had to go to their health services to be seen because we didn't have anybody on our campus. So I would go there and take the drive. I have an ear infection. Like, you need to take a look at my ears and give me antibiotics because they're killing me. So I got antibiotics, didn't do anything. So I went back 2 weeks later, said, okay, there's still something going on. Like, take a look at my ears, fix this. I'm in school, I'm seeing patients. Like, I am in pain and I have an infection. they're like, try this antibiotic. So I took another round of antibiotics. I'm like, okay, nothing. I go back. They're like, the only other antibiotic we have is this for you to take. So try this one because we can't give you anything else. Still nothing. So I'm like, something's totally wrong with my ears. I'm having all these issues. Like, nothing is helping. What's going on? At some point, it must have let up a little bit because I don't recall what ended up happening, but something got a little bit better at least. Probably stopped studying for boards. We're probably done with that. Boards were probably over at that point. So then at some point, I think I was done at school. I think I had graduated, and because I remember being home and I woke up at like 2 or 3 in the morning and crying pain because my ears were killing me. Like, I was like, I must have a horrible ear infection. Something is going on. So my mom takes me to the ER. The ER doctor's like, there's nothing wrong with your ears. I was like, yes, there is. there is something wrong with my ears. And they probably thought I was drug seeking at that point because they're like, there's nothing wrong. And I'm like, there is definitely something wrong. Like, you need to figure out what's going on. So they just wanted to give me more medication. And I'm like, no, I don't even want the pain medication. Just figure out what's wrong. Like, I'm not taking a script. I'm not taking anything. Just figure out what's happening here. So they couldn't find anything wrong. They told me to get an MRI or a CT. So I did that. That found nothing. You know, they were probably looking for a mass or, you know, something going on, but all of that came up normal. And again, it was probably all related to TMJ issues and just didn't know it at that point. But again, looking back, I'm like, oh, that probably could have been fixed if I just had known better at that point. And so again, a lot of chronic pain, a lot of, you know, people thinking I was probably crazy. But like, there's nothing wrong with your ears. I'm like, no, there's an infection. I know it. Like, there's something going on. Just take a look. But yeah, so that, you know, chronic ear pain and ear infections all the time could definitely be a sign of TMJ issues, and just had no clue.
I think it's great that you are continually like learning about new stuff. And I feel like this is something that's going to keep happening with you in your practice, because you know that like back then we didn't know half the things we know now about TMJ, oral facial myology, all that. Yep. And there's all this new research, and like the Breathe Institute, that's relatively new. Who knew that breathing was so important? Yeah.
Thought it would just happened, right?
It's just something that your body does, and that's all it that's all that happens. So you had vertigo?
Yeah.
And it wouldn't go away. Like, I just dealt with it for like weeks at a time. And then I had the Dr. Ed ortho, which is what you do, and it hasn't happened since.
Because you put your jaw in the right spot.
Yeah.
Paul, you should come talk about that.
There
you
go.
You're going to have her
there
talk about it?
Get in there. You talk
Come
about
on,
it.
I got a microphone. Come on, let's do it. Let's do it. I'll put a camera on you. Hang on. Come here.
I too am a guinea pig.
You are. That's right.
That's why you guys got married.
Because he just said, okay.
Only because I have no say in the matter. I'm defeated before I even go in.
Happy wife, happy life, right?
That's what they say. It's worked out so far.
Worked for 10 years, you're good.
That's right.
So what issues were you having?
Yeah, so for out of nowhere, like at some point in my adult life, I started getting vertigo, which is not anything fun. A lot of people might deal with it, and you're basically woozy. You can't walk, you can't drive, you can't really do much. And the only remedy was I went to go see a doctor, and they gave you a prescription that you could take that should alleviate symptoms. And then they give you some exercises to do too, where you're basically sitting on a bed and you throw yourself down and kind of roll around a bit and throw yourself around again, because the belief is it's something in your ear. I guess you're eustachian too, maybe. I'm not a doctor, but it's something that's just out of line. You're realigning the crystals in your head. And it didn't really work for me. I just learned to deal with it. I knew it would go away 2-3 weeks later. It wasn't like totally impairing, but it was significant enough to like, it bothered me. And it kept on coming back at least once a year for like 3-4 years. And I just came to learn to expect it. Like, it's going to come back, and I got to deal with it. Thankfully, my job is software development, so I don't have to do too much. I can sit behind a computer and work away. But yeah, it just vertigo was a thing that I just said I'm gonna deal with it and live with it. And then being the spouse of Dr. Erica, I get some perks here too, where as she's learning, as she's going on these courses and learning, she's like, yeah, "This is my husband for sure." You know, he's got these problems too. I'm gonna go work on him. He can't say no.
I think all wives do that.
Yeah. So she took some courses through Dr. Ed, and in tandem with Dr. Ed, I went through ortho treatment, which involved expansion, some of the same principles that she does here in philosophies to her current patients. And throughout that, it must have aligned something with the expansion and the ortho and pulling everything forward. Like if you see pictures of me prior to everything and to where I am now, it's like I could fit my old smile and teeth inside my current smile and teeth. Like it's just like such a dramatic difference in width of my smile, which is great because like the smile is awesome. You like to have a nice wide smile. And the other benefit of that is ever since at least I had the expansion, I haven't had any kind of vertigo or issue whatsoever. So it's been awesome. Definitely like not having to do those silly exercises. That didn't seem to work for me.
The most major bonus of your orthodontic treatment is that I don't have to punch you every hour at nighttime anymore because you're snoring.
Oh, the snoring, yeah. The snoring has been huge. The expansion.
That was my driving factor. I was
Yeah.
like, we need to get him to breathe better, so we're going to expand.
It's like either you need to go sleep on the couch, go in the basement, or find another bedroom because I can't handle this whatsoever.
Not only are we fixing teeth and breathing well, we're fixing marriages.
We're fixing and saving marriages, exactly. How many?